Okay, so this is for the barium enema. What I would do to start out with before meeting up with the client is get my supplies together. So I would use a double lumen barium enema tip. This is for the air contrast. And this is to inflate the cuff. You want to check the cuff before you get into the procedure to make sure that it works. You should only have to inflate it once to make sure that it holds the plate. I would fill the barium enema bag halfway, since we're doing a double contrast, which is about 1,500 cc's. I'd be filling this up with barium sulfate suspension, about 1,500 cc's, because we're using air contrast also. To use this, we are checking for any bowel obstruction, if there was any possible indication of tear, diverticulitis, or perforation of the bowel, then we'd be using gastrogram. So to start off with, I would first introduce myself to the client. Hello, Ezra. I need to make sure that you did all the preparation last night so we can continue with this exam.
Yeah.
Okay. So no food after midnight, just clear liquids. Yes. Okay. So from here, what I would do is I'm going to have my patient lie down. Lay on your back. Lay on your back. There you go. There you go. Just lie down, just like that. Okay? Okay. I'm going to be using a 10 by 12 because he's so small. I'm going to put it in portrait. Putting the right marker at the bottom right corner. So I put a 10 by 12 in, right marker in the right bottom corner. I'm going to bring my tube up 40 inches above the patient. I'm going to center right at the iliac crest, midline. This is going to show both flexures and small bowel, large bowel. I would shield just below the hip bone. And that would be my first picture. From there, okay, sir, I'm going to have you roll over onto your side. You're going to come back. You're going to lay this leg forward a little bit and this leg back. Okay. I would use the tip. I would close it off. I have barium coming down to here. Pinch it off. I would also have hemostats and gloves on. And this would stop the barium from flowing. Okay, so I'm going to have you take a deep breath in and blow it out and relax your pelvic region. From here, I would insert about 1.5 to 2 inches anteriorly and then curve with the anal canal. I would stop it and press the cuff once. Make sure everything was comfortable. Have the patient roll back onto their back and go get the radiologist. From here, the radiologist would perform their exam, and then they would look at me and tell me to take the after pictures. The after pictures would be starting, so this would still be inserted, but since my son is scared, I'm going to put it back up there. So the after pictures would, again, be an AP. Considering mid-leg to the body, right at the pelvic crest. I would shield. Taking a deep breath, blow it out, and hold it, X-ray. Okay, once I've changed out the film again, I put my right marker on again. Then we're going to move on to the next projection, which would be the AP axial. The thing I'm tilting the tube at 30 to 40 degrees. I'm going to center 2 inches below his as is in the midline. And this is going to be the axial view of the colon. Then from there I'd switch out my film. Run it in the DR. And then from here we would go into an RPO. And yes, patient, I'm so sorry. I know it's very uncomfortable. Then we're going to rotate him. I'm going to center at the iliac crest again, midline into the body. And this is really opening up the left collar flexure and seeing his ascending colon and the entire colon. From there I would switch out the film again, run it into the DR, and we would do the LPO. Rotate just like that. I'm going to center again at the iliac crest, and this is going to see the right collar flexure and ascending colon. Ascending colon. Then from there, I'm going to have him rotate on over to his side. Go ahead and bend both knees, sir, and I'm so sorry. We're going to get this done as soon as possible, okay? I'm going to move the tube down and take our lateral sigmoid colon. Picture right here on a smaller film, probably an 8x10 for us. I'm going to center right here at the as is and shoot through. All of these KV should be around 90, and for Ezra, probably no more than 20 pass to shoot through the barium. So from here, go and stop it for a second. Okay, so from here we're going to do left lateral decubed. I'm going to shoot it PA. I'm going to rotate the tube around.
Now that way, then X-ray.
Yeah, I know.
Picture of the
So,
back.
You're going to go ahead and lay just like this, sir. Thank you so much. There would be a grid on this film. I would have the patient up as close as possible as I can to the film. I'd have my right marker up on top of the film. I would take an X-ray. Take an X-ray midline through the body again, centering right at the iliac crest. Then from here, I would have the patient roll over. And again, sir, you want to put your back all the way up against this film, please. I would switch out the film as fast as possible and switch my markers and put the left marker on top. This would be my right lateral decubed AP. Then from here, we would be done with the grid. Okay, during all those exam pictures, I would have the bag on the table. That way not to be flowing any more barium up into the patient. Once we're done, I would deflate the cuff, bring the bag lower and put it into the bread disposal bin. I would have the patient get up and go to the bathroom. And then when they were finished cleaning up and come back out, we would do one posted back picture, which again would be centered at patient's midline body at the iliac crest. Taking a deep breath, blow it out, and hold it. And then we would be finished. And keep breathing.